Spent countless hours in the garage with your dad. Now investing in that old car and working on it with your son reminds you of him. And his legacy lives on. Fund your passion with a low-interest home equity line of credit from Bank of Blue Valley.
Oh, my God.
Oh, got a rolling chair here. It looks really
only have
cool.
2 more shows you're allowed to do that on. Remember, we agreed it was over in 2020.
Yep, 2 more. And I like the, the cheesy 80s music as well. Everything's going away in 2023. It's not that far away.
You're not going to be allowed to roll in like that. You promised. You pinky promised.
Only because I really like you and you're an amazing friend and you're asking me not to, but I don't want to.
And I am asking you not to because I'm a good friend to you too.
I know. That's why I said that's why I'm not going to do it. So, obviously Bank of Blue Valley and Burns McDonnell are doing amazing. Our CEO that we'll be introducing is doing amazing. How is Aaron Fulk doing? How is the end of the year doing?
Man, we are way busier than we've ever been at the end of the year in all 7 years. Do you want to hear something kind of exciting?
Yeah.
So we had a virtual retreat last week just to kind of wrap up the year or whatever team-wise. And I hadn't really pulled my numbers. I pull them like monthly, but I hadn't pulled them for the whole year since probably April or May, really, because I'm not the numbers person. I trust my numbers people. Guess what?
Best year?
December 1st. It was our best year, and we still had a whole month left. Yeah, ever.
That's you don't want to sandbag it for the last month, but you got that going for it.
Yeah, no, I'm not sandbagging it. We've already done real well this first half. So, but I was really excited. I'm like, who saw this coming in 2022? Nobody.
Yeah, you're like, our business is all going to be shut down during this pandemic, or I think it's like something else. But one thing that's not shutting down is the hiring going on at Bank of Blue Valley and Burns and McDonnell. The Infrastructure Act, if you will, follow the broad economy. A lot of that is roads or power or distribution or water, and a lot of that comes from Burns and McDonnell.
Right.
And so they are continuing to hire. So their HR team, I want to say it's like 15, 20 people. So, if you go to their website and see an open opportunity, you will get a call back. So always a great place to check out.
Look, we got a first-time watcher. Paul says, watching first time on LinkedIn. Thanks, Paul, for tuning in. And Lucas, thank you very much. All right, let us know where you're watching from. Are you watching on LinkedIn, Facebook, YouTube? Let us know. Do you know Will? Is this your first time meeting Will? Will is amazing. I met Will through Scott, and I'm a big Will with 1L fan. Big Will with 1L.
I don't know of anyone that doesn't love Will. So
right.
It's something that he just meets everyone. He's like the person in the room that just like everyone gravitates toward, and they're like, I think I'm going to hang out with that guy.
Hey, I'm going to totally hang out with Will. I think Will's great. So let's be done with us.
Yeah, let's get going.
All right, here's the deal. Will Franklin!
How's it going? I thought about rolling in, but then I heard the discussion a minute ago, and I was like, well, maybe not.
Please don't do it.
That would have been awesome.
I would have listened. I can see down here before you come in. I would have just waited until you got in.
Right.
Look, Samuel's watching on LinkedIn. Everybody's excited to see you here, Will. All right, we're going to start off like we do every show. Who are you? What do you do? How do you get to Kansas City?
Awesome. So my name is Will Franklin. I serve as the CEO of KC Care Community Health Center here in Kansas City, which community health center, for those of you who don't know, and we serve about a little over 23,000 patients across 3 locations in the metro area. mostly kind of Medicaid uninsured population. So a lot of the work that we do is nonprofit in nature. How did I get to Kansas City? Well, I came to Kansas City for this role. Was serving as the COO of another organization that was similar in St. Louis. And so spent about 14 years in St. Louis and came to Kansas City for this role. But I've been coming to Kansas City probably by the last 8 years as a consultant working with what's now Health Forward, used to be the Kansas City Healthcare Foundation. So I knew a little bit of the landscape through that work and really liked Kansas City, but I was here a couple times a year. So now I get to stay here permanently.
Look, Dr. Nicole says she's a huge fan of you.
Oh my goodness. I was nervous before, but now that I know that Dr. Price is on the call, I'm really nervous.
Yes.
I'm kind of a fan of
Dr.
Price,
Scott.
so this is weird, right?
So
we gotta get her on here. She did a great thing this morning. She does a live on Tuesday mornings, and she did a great one on empathy today. So don't be too nervous. We got you, Will. Okay.
So Aaron runs the show, but I do want to ask.
Sitting on my desk right now, so that's pretty interesting coincidence right there.
So Aaron runs the show, but I do think she would love hearing a little bit of your short background before you got to Kansas City. Sure. I think that plays an interesting role into the CEO that you are today. And then second, how broad of a reach does your organization have? Because I know Aaron's going to have tons of questions.
Sure. So prior to kind of getting into healthcare administration, I'm a behavioral health clinician by training. So my background is actually in clinical psychology, and kind of stumbled into some healthcare leadership roles by accident here and there in my career. And then they just kind of stuck from there. So that's kind of my background in training, and really my come from. I think sometimes when I think about leadership is really kind of really understanding people and personalities. And in terms of the reach of the organization, KC Care, like I said, serves about a little over 23,000 patients across the region. In terms of outpatient primary care, dental, behavioral health services. And then we're also the region's largest HIV provider, and probably the largest HIV provider in like a pretty big radius. And so it's one of those things where we're actually more well-known outside of Kansas City than even inside Kansas City because we're a kind of a national best practice in regards to that type of specialty care.
Is that your office?
It is my office, and I apologize for the sirens.
I'm
right on Broadway, and I can't avoid that.
It's the city sound, and I like it.
Right.
Real quick, did you read your book?
I did read the book, Dr. Price. But
that was amazing.
But now I'm nervous because she's going to ask me questions.
Okay, I have a business question to ask you. First of all, that's amazing. I want to get into a lot of that, but something that you said at the beginning is one of my questions. Okay, you went from COO to CEO, and often in business, because it's a business show, we are trained that those are two very different personality styles, right? I will tell you right now, I'd be world's worst COO because I am operationally challenged. Okay, how did you make that change, and which one do you feel you were more like your natural skill set went to, and how did you learn how to do the other one?
Sure. So I think I'm probably naturally more of a CEO. I think I was stuck in a COO body for a while. I know how to do that work well, but it was a big transition because sometimes, like, I'm used to explaining things with a whiteboard and going over like Gantt charts, backwards planning, things like that. Whereas in the CEO spot, there's a lot more persuasive type speeches that you have to give, and you have to move a little bit away from the whiteboard doing algebra problems in front of everybody mentality. So that was a big switch. And I think I think probably the hardest transition though was like I had never had someone before in my life who helps me like manage my calendar and all those pieces. And that's been, I think, an ongoing challenge, even 3 years into it, like giving away that sense of control, managing my calendar and all that, but trying to make sure that like I'm focused on the important things every day.
Yeah, I have I say I have a Chloe. I have an assistant named Chloe who's amazing. And half the time I'm like, she knows my life better than me at this point.
Right.
Where am I supposed to be, Chloe?
Well, and you have to be like coachable and be willing to be managed up too. Mm-hmm. And like, that means like listening when people tell you like, you know what, actually don't do that. Or, hey, you know, what'd be helpful is if you would do this, right? And so just being like, open to that kind of concept of being managed up, I think is important.
Okay, go ahead, Scott, and then I've got another one.
So when you were talking about Dr. Price's book, one thing that, you know, I think you, Aaron, and I share is a love of empathy, meaning we gravitate towards people with empathy. You know, when you were working in your work in the penitentiary system, and what you've done as a minister or working in the ministry, you know, how do you feel? I feel like you understand empathy, not that you would say, because you're very humble, but you understand empathy more than most anyone that you could walk across. Where does that empathy come from? Is it something that you were raised with? Did you learn it? How did empathy come, and how does it play a role as you as a CEO?
Sure. Well, I think empathy is critical as a leader of an organization, because the reality is people are what make the organization work. And, you know, that's your greatest resource as an organization. And empathy really drives how you engage with them. You know, one of Casey Care's strategic priorities is actually being an employer of choice, because we feel like we can't really manage the relationship of the community and the patients that we serve well if we're not managing the relationship between the people who work here and the organization. But like, I think that my background, interesting you say that, because like, whether it's my background working as a clinician in a maximum security, you know, prison system, I remember like being really like struck by the fact that when I worked in maximum security federal penitentiary in Pollock, Louisiana, that the guy who came in and cleaned my office, I liked him. I liked that we talked sports a lot. We had actually a really good relationship, but you know, he did some pretty horrible things to be in prison for life. And I remember that being kind of really struck me as like an example of how people are different and separate from their behaviors at times, right? And that everybody's doing the best they can with what they had to work with. And sometimes what people have to work with looks different, right? I also think it was something I grew up with too. I was raised in a home of three women. I lived at different times with my mom, my aunt, and my grandmother, and in different orders at different times in my life. And so I think that that was something that was important to them and a value that they really instilled in me as well. So but in terms of like the driver of relationships, understanding the people that you work with, and sometimes leadership is really meeting people where they are and you changing, not so much asking other people to change or do something in relationship to you. So
when you were going to school for psychology, what did you think your future would look like with those psychology degrees? And how much do you find yourself leaning on that education now?
I actually feel like I'm doing even more work in that regard. And I apologize for the glare. I have this one piece of my blinds back here that the sun keeps trying to peek.
Same here, yeah.
So in terms, I feel like I lean on that training pretty frequently in my role, because I have friends who do family therapy still for a living, and they sometimes ask me, they're like, so do you miss clinical work? And I'm like, well, I do it every day. I mean, I sit in a room with a chief medical officer and a chief financial officer, and that's like just like doing couples therapy. It's the same thing every day, you know. And so in some regard, I lean heavily on that. And when I went into psychology, I had no idea that I'd end up doing what I'm doing now. I think that I thought of myself as doing kind of more direct clinical service work my entire life. And then just realized I could make more of an impact at a macro level too.
Awesome. I still have questions, Scott. You want me to keep going?
I just thought you'd be in. I wanted to leave it.
I'm really into Will.
I know you have so many questions for him, but I have
one like side question for you. And if this is too personal, just tell me shut up and we'll go to the next one. You said you grew up with your mom, your aunt, and your grandma. Did you grow up with your father in the home as well?
So no, my parents got divorced when I was about 5 years old and did not see my dad. I did reconnect with him when I was in high school, and we had more of a kind of a friends relationship. And then he passed away very suddenly when I was in my late 20s. And so yes, in some ways, and no in a lot of other ways. Not in the typical what you would think of having a dad in the home would be like.
I just think you turned into a really incredible man. So that's something for people to.
Well, thank you. I don't know if I have it all figured out yet, but and maybe that's part of it is, not always having a model. My mom did get remarried later, but I was, halfway out and they had little kids. So I was kind of on my own a lot.
When it comes to, we had another guest on recently that did some work in the HIV space, and I kind of kicked myself for not asking this question because I feel like when I was a kid, right, we talked a lot. It was like scary. It was the HIV world was scary. And then from what I remember, at some point a basketball player got HIV, and then it got less scary because there became a cure that we all knew about, but not really a cure. Like it was just manageable. And then it's kind of like the conversation stopped at a overall, making it like in the news all the time level, not necessarily at the medical level or anything like that, but for everyone that's not in your seat. What do you think is like the overall population with people with HIV now? Are they more accepting? Do they have more empathy? Are they more willing? Because there was an area I remember when I was a kid where it was like almost like leprosy back then, right? And where do you feel like our mindset has shifted as the public?
So that's interesting. All that being said, I think stigma is still probably the number one barrier to really eliminating the disease completely. Mm-hmm. Whether that's stigma around the United States, it's thought of as a disease connected to homosexuality or some type of IV drug use, and yes, you can get the disease through those things. And there are some groups that are going to be naturally more at risk than others. But the reality is HIV is a public health crisis across the globe for lots of different reasons. It's just in the United States, the stigma piece really stuck. And you're right. I remember even as a kid, nurses that I knew who would be worried about getting HIV from a toilet seat, right? Which is, even back then they should have known better, right? But I do think there was, I think this is a great, HIV is an incredible example of when you really invest in a disease state and focus on that disease state, you can make significant impact. And so there's been a lot of legislation, the Ryan White funding mechanism, that has really changed the trajectory, the drugs that have come on the market. So HIV is essentially a manageable chronic disease now that you can live with, much like you would live with diabetes or hypertension. And so you can actually, on the right medication regimen, essentially be untransmittable and undetectable. In other words, you can't even transmit the virus. I think sometimes because we're not hearing of people dying as often as we used to hear about it, I think the people don't think of it as much of a crisis as they used to. However, like at any given moment in time, and like, let's just say the Kansas metro area on both sides of the state line, there's probably about maybe 1,000 people that probably have HIV and don't know it. Those 1,000 individuals are likely the source for the 200 new cases every year. And what's interesting though is like it's a CDC recommendation that everybody, all adults, get tested for HIV at least once a year, but very rarely in your primary care doctor offices do people say, oh, we need to do your HIV check. Because the reality is the kind of at-risk groups that you would think of a lot of times stereotypically, those populations are aware of HIV. They're engaged. They know what the risks are, and they're involved in getting tested and things like that. It's actually the groups that you don't think of. I've heard of situations in other parts of the country where nursing homes have been a big source of HIV, or like in those types of situations. And it's the reality is until it's just a normal thing that you get tested for, just like you get your labs done for your physical. If we could just find those 1,000 people in 7 counties on each side of the state line, you could literally eradicate HIV from the region.
I've heard nursing homes are wild. I've heard some of them can be wild on the.
I don't know, but sometimes when I hear the stories like that, I imagine that I bet they can be kind of hairy sometimes.
Nicole, she said she learned last year there were medicines that prevent transmission. You just fucked that. Nicole, I love how engaged you are right here. Thank you so much.
I just found the comments tab.
Said, why would that be? This is about a 20-second delay, so I wonder, because probably to your nursing home comment, because they are wild.
I can speak to that. I was recently in a conversation, and someone was talking with someone in a nursing home, and she's a single girl, and she was amazed about how much fun the nursing home was as she was talking to her grandmother, and was like, wow, Grandma, you've been on more dates than I've been. And so
they're like, F it, we're gonna have a good time.
Yeah, I just knew that Aaron, you had not had a chance to kind of get a little bit of Will's background, but one thing that I think you both do as parents and as CEOs is you let people think. It's something that I want to learn a lot as I'm raising my children, and you guys both have wildly independent children in a great way. And so, Will, when you, sometimes some people are quick to try to solve things, but that doesn't necessarily help everyone. Where I think you and Aaron let people figure it out. Where does that come from, and how has that served you well as a parent and as a CEO?
Sure. So, I mean, I think even a lot of that, some of that is steeped in kind of clinical training too. And also just, I think, in the home I was raised in, thinking quick on your feet, solving problems was important, coming up with your own solutions at times. But also, even as an early clinician in the process of therapy, there's a part of me that, like, when you meet with someone, you see like all the potential, right? And sometimes you want to kind of push, pull, or drag people to the finish line because you can see that for them. But the reality is, unless they see that for themselves, that's hard work to do, right? And the work of change, which is an adaptation, which is life and is our work life in a lot of ways, I think is very much that way. I think it's important for people to have a say in things. It's really important for a sense of control and predictability. And when people are engaged and thinking on their own and have skin in the game, I find that, one, the quality of the solutions are much better. 2, their willingness to adopt whatever those solutions are much higher as well. So, Scott used reference kind of even as a parent. Well, even in moving to Kansas City, when I found out that taking this job was going to be a reality, I have 4 kids, and they're all 2 years apart, but, I wanted them to have a sense of control and buy-in in the move here. So I told them, I was like, well, I'm changing jobs and school is your main job. So let's figure out where you want to go to school. So I basically put them on the project of researching the school districts. They looked at schools across the whole region on both sides of the state line. And then they came, and we came and had some like fun time here in Kansas City, so they could associate it with a good time, right? But then while we were here, we would visit a lot of the schools, and they toured the schools. Even my youngest daughter at the time was going into first grade. She even had a checklist of things that were important to her in a school, right? And was kind of marking those things, and they kind of came together and they gave us like 2 options of a elementary, middle, and high school track. And I think that was a big piece of their, settling in here in Kansas City in terms of liking their schools and things like that, is because they had some choice in it. So I don't know. I think as a parent and as a CEO, getting people to think and contribute, in my mind, makes them happier and more well-adjusted. But then too, they become a piece of whatever change you're trying to create, and allows them to put their vision into it as well.
What is your goal? We've got 4 minutes left. What is your goal that you want to accomplish in 2023?
Well, in 2023, here at KC Care, we are in the throes of planning for a lot of expansion and doing that in a smart way. I mean, the reality is there's more demand than we could possibly keep up with in terms of behavioral health needs of the community, in terms of primary care. Because even though we have Medicaid expansion, and even though there's insurance plans on the exchange, that doesn't necessarily always equal access to care and to high quality care. And so really we're trying to kind of make good on a promise of increasing access to care, but in a trusted and unconditional way. And so the thing that I think about in that regard is really addressing health equity in the Kansas City region. And when I say that, I mean, there's 2 neighborhoods that can be 7 miles apart, but be significantly different in terms of life expectancy, health outcomes, access to plumbing and running water, right? And all of those things create significant barriers that we're hoping to really address in partnership with our providers in the community, but then also to really focus on those individuals who are more impacted kind of by those social determinants of health than others, so that we raise the bar for everybody in the region. So that's really from a goal, expanding to make sure that we're meeting the most critical needs in the region.
Okay, so you're a nonprofit, and there might be some people watching this show that have some money to get rid of by the end of the year. So can you tell them what's the best way to donate?
Sure. So you can actually donate on our website at kccare.org. And there's actually a tab there where you can contribute. You can also volunteer. So there's all kinds of different ways that you can give time, resource, and contribute to the outcomes of the organization. It's a great mission to be a part of. We've got a really great group of people who make it all happen. So.
Okay, Scott, you got any last questions? Otherwise, I got a really funny comment from Nicole.
No, I'm excited that you and Will got to know each other better, because you guys are both.
We hang out.
I know, but I just thought it was cool that you guys don't see each other in a who's who situation of seeing each other, and you get to learn each other's background, provided by Bank of Blue Valley and Burns and Mac. So, Aaron, what is the cool question?
I also let my kids choose their schools, so we're right there together. Well, all right, here we go. She just said, all I can think of is my 79-year-old dad. He can barely walk away about the nursing homes. Will's like, I did not mean for this conversation.
Oh, I'm telling you, there was someone there like, hey, Grandma, you're cooking more than I am.
Right.
You know, it's a happening place. It's like a dorm room. You get a lot of social action.
Thank you so much to Bank of Blue Valley and to Burns and McDonnell. Thank you so much, Scott, for co-hosting. And more importantly, thank you so much, Will, for coming on. If you want to connect with Will, he is tagged over here on LinkedIn, so make sure you connect with him. We will see you same time, same place next week for our last show, and our guest will be Andy Rieger, so make sure you come. Bye, guys.
Thanks.